Hello, my name is Chaney Adams, and today I'll be presenting my population-focused prevention plan focused on improving depression outcomes among adults in Houston County, Alabama. This plan is based on an evidence-based intervention and adapted to meet the needs of our local community. Depression is one of the leading causes of disability worldwide, and it significantly impacts quality of life, chronic disease management, and suicide risk. In Houston County, Alabama, depression and anxiety are major concerns, especially among adults receiving care in primary care settings. Rural communities in the county face unique challenges, including provider shortages, transportation barriers, and persistent stigma surrounding mental health. These factors make depression a priority health problem for this population. According to the CDC's Behavioral Risk Factors Surveillance System, millions of adults continue to struggle with poor mental health, reinforcing the importance of addressing this issue. Nationally, depression remains widespread and is a major contributor to disability and healthcare utilization. Locally, Houston County's rural areas experience limited access to mental health services, higher poverty rates, and long wait times for psychiatric care. These factors increase the likelihood that depression will go untreated or undertreated. Together, these data points support the need for targeted prevention planning. Since I do work in the outpatient setting, I see constantly the toll that our patients have with not being able to make their appointments, not being able to get their medications due to being on a fixed income, and that is another issue why mental health is going untreated. Depression is closely linked to increased morbidity and mortality. It raises the risk of suicide, worsens chronic medical conditions, and increases emergency department visits. Rural populations, including those in Houston County, often experience higher rates of untreated mental health conditions due to structural barriers. This makes early intervention and coordinated care essential. When we look at the population variables in Houston County, we see a mix of strengths and challenges. Some of the strengths include a strong primary care presence and community organizations that are willing to collaborate. However, health risks include high poverty levels, limited insurance coverage, transportation challenges, and the mental health stigma that is everywhere. Health influences such as rural geography, limited psychiatric specialists, and social detriments like internet access and education further complicate access to care. And then every factor increases the risk of mortality. The intervention guiding this plan is the Collaborative Care Model, or CCM. It will be referred in the rest of the PowerPoint as the CCM. This model was evaluated in cluster randomized controlled trial by Hammerberg and colleagues in 2022. In the study, nurse care managers worked closely with primary care providers to deliver structured follow-up behavioral activation, education, and coordinated care. The results showed significant improvement in depressive symptoms and quality of life in 12 months compared to usual care. This makes CCM an excellent foundation for our prevention plan. Why this model fits Houston County. The CCM is particularly well suited for Houston County because it addresses several local challenges, helps compensate for provider shortages by using nurse care managers, improves the continuity of care and patient engagement, and importantly, it can be adapted to include telehealth, which is very good for the rural residents who face transportation or distance issues. The core components of the intervention include assigning each patient a nurse care manager, developing individualized depression care plans, providing education about depression, supporting behavioral activation, and conducting 6 to 8 structured follow-up calls during the first 12 weeks of treatment. Care managers also coordinate closely with PCP, primary care providers, to ensure timely treatment adjustments and ongoing support. To make this intervention effective in Houston County, several modifications are necessary. First, telehealth services should be integrated to reach rural residents. Secondly, partnerships with psychiatric nurse practitioners or psychiatric treatments can help address specialist shortages. Third, the social detriments of health must be considered: the transportation issues, internet access, the stigma. Community education and integration of behavioral health screening into primary care can help reduce stigma and improve engagement. Successful implementation will require strong community partnerships. Potential partners include primary care clinics. We also have a local hospital here named Southeast Health. It has a mental health facility in it for adults that could be helpful as well for stabilization, just in case it is needed. Pairing with the churches and the community centers around here and the public health departments also could be helpful, and then finding telehealth providers to help work with the community to get people approved for telehealth, because some insurances don't allow it. The interdisciplinary team is going to consist of people who help make the team that takes care of the patients and involved with the patient's care. It's going to be primary care providers, psychiatric providers, social workers, counselors, nursing managers, telehealth coordinators, just trying to anybody and everybody that can contribute to the better health of the patient. This is a picture of the health department in my community. This intervention can be implemented in rural clinics. The county health department could also be helpful. Libraries that serve as important partners by providing internet access for telehealth visits. The step-by-step is going to be, as you see, just the first one's identifying the people that have, the adults that do suffer with depression and anxiety. Every time you find somebody that has depression or anxiety, you need to assign each patient a nurse care manager. For each patient, you'll have an individualized care plan, and then you'll provide education to each patient on depression and treatment options, and then you'll conduct the structured follow-up calls that are the 6 to 8 phone calls over 12 weeks, and then you'll coordinate care with primary doctors and psychiatric doctors. You'll start tracking the symptoms using that PHQ-9, which is the depression scale, and you'll get that at baseline, 12 weeks, 6 months, and then a 12-month progress. You'll record the data just to see if you can figure out if the CCM is being helpful or not. You'll provide the resources that should have been implemented to help, like transportation and support groups. And then finally, you'll evaluate the outcomes of everyone and adjust the care plans as needed. To evaluate the effectiveness of the prevention plan, we'll use the same measures applied in the evidence-based practice intervention. That includes the PHQ-9, comparing the quality of life that the patients have reported, handing out patient satisfaction surveys and have them complete them, look at the follow-up completion rates for the whole program, and then, of course, all of these are going to be that go from baseline 12 weeks, 6 months, and then 12 months to see the transition of care. The CCM that we are using should show that the depressive symptoms will be reduced in patients, as well as the fact that their quality of life should be improved and they should be doing a little bit more. This also should help with continuity of care, and it should give patients higher satisfaction with mental health services. There are a few barriers that we have come across. I will say in rural Alabama, Dothan, there is limited internet access for telehealth due to rural areas. Sometimes you can't even get on social media or whatever. There's still a transportation issue, but there is community resources that we do have. Provider shortages, there's never enough of those. Lack of funding, We'd have to work on getting some grants. And then also the biggest barrier is going to be the stigma that everybody has around mental health. The strategies to overcome these barriers is going to be using phone-based follow-ups instead of video, to try to see if you can get something out of them. I will say that it's hard to read somebody if it is over the phone. Partnering with the local transit services to help with a transportation issue that does occur because of the rural areas. Seeking the grants for the mental health program, and then training the existing nurses as care managers. And for the stigma, hopefully we can reduce it by doing community education campaigns and just other things to get the community support around mental health. Overall, the depression is a major health issue in Houston County that affects many people. The CCM is adaptable to different specialties, but modified intervention addresses rural barriers that keep people from going to doctor's appointments, like the transportation issues that people have been having. And strong community partnerships can support the methods going into practice. And then when patients complete their evaluations, it ensures that there is a measurable improvement in outcomes. That's how it becomes evidence-based practice. Thank you, and have a good day.